We are live now. You are muted, Dr. Prashant. You are muted.
So good evening, postgraduates, and my namaskar to all the mentors. Thank you once again for logging in. Yeah. So this is a pan-India intercollegiate quiz being hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, and it's the Big Q. So this is a familiar tune to most of the people who have been following us for so many years. And this is the 5th season, so I think this must have been marked up by most of the people who are being participants, regular participants. So good evening, friends, once more, and my pranam to all the mentor. Well, Brain Teaser team welcomes you to this first semi-final of this 5th season of Big Q. Well, for the people who have logged in for the first time, Brain Teaser is an online platform for hosting quizzes for ophthalmologists of our country since last 7 years or seasons. It was 4 years back, rather 5 years back, for the first time in our country, the team Brain Teasers initiated an exclusive quiz for postgraduates with the single aim of getting all the postgraduates from across the country on a single platform. There are approximately 320 plus institutions offering post-graduations in ophthalmology, be it MS or DNB. Every season we have been getting a slow increase in the number of teams participating. And this year we are extremely happy. We had 250 plus teams who joined this particular season 5 of ours. This season, again, we are hosting in association with Ophthalmological Society of Nagpur, and we are extremely thankful to the President of Ophthalmological Society of Nagpur, Dr. Shamik Mokadam, for associating with us for this Big Q. Well, this 5th season had in total has 13 episodes. We had 6 preliminary rounds, 4 quarterfinals, and today is the first semi-finals, which will be followed on following Wednesday with the second semi-finals and then a final. These episodes would and have been aired on alternate Wednesdays at the same time, that is 7:30 p.m. Brain Teaser team is extremely thankful to the team of quiz masters who toil hard to create a wonderful experience of learning with fun. Today, we are privileged to have all the 3 quiz masters who have been associated with us since the inception of this particular Big Q. Dr. Purvi Bhagat, who is currently working as professor and head of glaucoma clinic at M&J Hospital, Ahmedabad. Dr. Annapurna Kumari ma'am, she is a postgraduate teacher at Arvind Eye Hospital, Pondicherry. I would take 1 extra minute. Dr. Annapurna Kumari ma'am has been associated with us not only as a quiz master, but she is also a backbone of she helps us in formatting the quiz. She helps us in correcting the questions, helps us in doing whatnot, everything, all back end work for what then evolves as one of the fantastic shows of quiz. Thank you, Annapurna ma'am, for being associated with us for every now and then, not only as a quiz master, but helping us out with our back end work. Also, we have third quiz master, that is Professor Dr. Jaspreet Sukija, who is a professor at PGI Chandigarh. Thank you all the quiz masters once more. Well, nothing is possible without a strong financial backing, and this season also we are extremely privileged to have His Highness as our partners in this particular season. My sincere most gratitude goes to Mr. Surya Narayanan, Mr. Naresh Rautela, and Mr. Kostu for their support and helping us initiate this season as well and making so many postgraduates enroll for this. Smooth and flawless execution of Brain Teaser platform, all registrations, live quizzing, computing results, and other backend work happens without any hiccups, and all the rather credit goes to Numeratic and team headed by Mr. Sai. Thank you, Sai, and your team for such a wonderful um, association. Last but not the least, my right and left hand, rather both hands, Dr. Shilpi Narnavre, who is a vitreoretinal surgeon at Sarakshi Netralaya, who is a co-host. May I request her to familiarize the participants with the rules of the game for today's first semi-final. Over to you, Dr. Shilpi.
So, welcome friends to the first semi-final of today's of this season. So there is little bit change in the rules. So in semi-finals, total 21 teams will be playing. Today is the first semi-final, and today 11 teams are playing. Next semi-final will be on 6th of May, that is next Wednesday at same time, 7:30 p.m. So for teams, you need to log in from two platforms, that is Kahoot and Zoom. But every team needs to log in only from one email ID. If you log in from two email IDs, and then your marks will not be calculated. The first screen is a live quizzing on the Zoom platform. And today, out of the 3 rounds, 2 rounds will be with the quiz masters face to face on the Zoom platform. And this is to be played only by the teams. While the second screen is the Kahoot platform, both for the audience and the teams, and it is for the MCQ round. I request all the mentors to log in from separate screen only on the Zoom platform. So now out of the 11 teams playing semi-final today, 5 will qualify for the finals, and the criteria is the today's marks only, and we will not be calculating the preliminary marks for qualifying for the semi-finals. Now coming to the rules. So the format will be, we'll have 3 sets of MCQs for both the audience and the teams, and each set will have 5 questions. No negative marking in the MCQ round. The rapid fire round will be only for the teams, and you will have to answer 5 questions in 40 seconds time. So we have increased the time to 10 seconds, but this time all the questions will not be displayed together. It will come one by one. Either you have to answer the question or say pass. Until unless you will say anything, we will not be displaying the next question. So remember, if you don't know the answer, say pass so that we can display the next question. As before, correct response you will get +10 and incorrect -5. The next round is the image based round, that is also only for the teams. In this, you will be shown either a 1 or 2 images based on a case, and then 3 questions will be asked based on that image. You will get 20 seconds time to answer these 3 questions. Again, only if you answer or pass the first question, then only we will display the next question. So in this round also, correct response, you will get +10, and for the incorrect, it will be -5. Teams who are not playing today's semi-final, you can play as an audience in the private practitioner category. And remember to write PP in front of your name if you are not playing today's semi-final, because if you will not put the PP, it will not be counted. So these are the prizes for the teams in the finals, while we have 5 prizes for the audience per episode. So with this, I invite our first quizmaster, Dr. Purvi Bhagat ma'am. She is professor and head of glaucoma clinic at MNJ, Ahmedabad. She had 117 publications and more than 225 presentations in various conferences. She has done international fellowships in medical education, FAIMER and FAIMEI from USA and CMC Ludhiana. This Connect the Ambassador and Connect Steering Committee member Philadelphia. She is honorary FICO Award by selection in 2025 for comprehensive ophthalmology. To her credit, there are various prestigious awards and presentations at various levels. So these are the list of the various awards she has earned over a period of time. With this, I hand over the screen to Dr. Purvi ma'am.
Thank you, Dr. Shilpi. And all the best to all the teams and team members.
So, ma'am, shall we start?
Yeah, please. Yeah. So the first MCQ is the hoarfrost ring is seen in options, please. A. Pigmentary glaucoma. B. Pseudoexfoliation. C. Angle recession. And D. Acute angle closure. And your time starts now. Okay, so the time is up. And the answer is, it is seen in pseudoexfoliation. Next slide, please. Yeah. So the dandruff-like fibrillar material that you see on the anterior capsule, it very closely resembles the hoarfrost. That is the icy, frosty appearance that is seen in extreme wind, cold climatic conditions, those needle-like appearance. So that is pseudoexfoliation. Next, please. The illumination gap theory explains A. Positive scotomas, B. Photopsia, C. Positive dysphotopsia, and D. Negative dysphotopsia. And the time starts now. Okay, so the time is up, and the answer is, it is negative dysphotopsia. So basically, whenever the diffraction happens through the edge of an IOL, then there are some rays which get refracted through the center and mid periphery of the IOL. There are some rays which get diffracted through the edge of the IOL, and there are some which miss the IOL and directly pass into the posterior segment. So there is a gap of illumination created, which is known as the illumination gap, and it leads to negative dysphotopsia. There is no treatment for this actually, and you just need to counsel the patient, and with neural adaptation, this photopsia gradually disappears. Next, please. Hypopion uveitis is classically seen in sarcoidosis, B. Tuberculosis, C. Toxoplasmosis, and D. Behçet's disease. And your time starts now. And the answer is Behçet's disease, right? So HLA-B27 associated uveitis and Behçet's disease are the most common non-infectious uveitis which lead to hypopion. It is a very common presenting feature. Next, please. So you can see this image. You just have to give the diagnosis, right? The options are CSR, central serous retinopathy, B is wet ARMD, C is diabetic macular edema, and D is macular hole. And your time starts now. And the answer is, it's fairly simple, especially for a semi-final round. It's wet AMD. You can see the Brooks membrane is labeled there, and you can see the fluid collection and all the excrescence is there. Next, please. Sensitivity of a test refers to A. True negatives, B. True positives, C. False positives, and D. Accuracy of a test. Your time starts now. So the time is up, and the answer is sensitivity of a test represents the true positives. right? Next, please. Yeah. So basically, it identifies those patients in a population who actually have the disease. That is a true positive rate. And specificity, when you say it is the number of true negative tests. So sensitivity is important for screening, and specificity would be important for diagnostic confirmation. Next, please. I think we are done with the 5 years.
Yes, ma'am.
Yeah.
Ma'am, you
So
need to.
yes. Yeah. I now invite Dr. Annapurna Kumar Madam. She is a former professor of ophthalmology and currently a PG teacher at the Arvind Eye Hospital, Pondicherry. She is also the creator of her YouTube channel, AP's Ophthalmology Pearls, having more than 44,000 subscribers, and the channel has more than 300 videos and more than 2 million views. And she does daily quizzes on the channel since the last 4 years. So welcome, madam, and over to you, please.
Thank you very much, Dr. Purvi.
So, ma'am, shall we move ahead?
Yeah, just before that, I'd just like to tell the PGs. So this will be a case, and along with each case, there will be some images. I will give you just a couple of seconds before the timer starts for you to just absorb what is in the image. And like Madam said, each question will come only one after another. And I will not read out the question to you so that it saves you some time and you can read the question yourself and just answer or say pass. That's all. So can start still.
Okay. So, the first team to play is Team 4. Team 4, 4 visionaries from KMC Mangalore.
Okay.
Yes, ma'am, we are here. Good evening.
Good evening.
You are here. So, so please introduce yourself. Already we have displayed the slide.
Good evening, ma'am. I'm Pallavi. I'm a postgraduate from KMC Mangalore.
I am Anaga and postgraduate from KMC Mangalore.
Okay. So this is case-based set. So you need to select the set you want.
Set 6.
Set number 6. Okay, just give me a second. So this is your question.
So all the best, team. A 72-year-old hypertensive man on aspirin is undergoing phaco under topical anesthesia. During the process of cortical aspiration, the anterior chamber suddenly shallows. The patient complains of severe pain, and the surgeon observes the intraoperative findings shown below. So I'll just give you a couple of seconds. Your time starts now.
Pass.
Pass.
Okay, time's up. Can we have the answers, please? So this is a suprachoroidal hemorrhage occurring on the table, and the immediate step is closure of all incisions. And intraoperative drainage is generally not indicated in the acute stage unless the intraocular contents are coming out, they cannot be reposited, or the raised IOP is threatening the optic nerve. And optimum time for drainage is after 1 to 2 weeks when there is liquefaction of the clot, and that can be determined by B scan. Okay. Next team, please.
Okay. So the next team is Team 7. Team 7, Jalgaon Avengers from GMC Jalgaon. Team 7, are you there?
Yes, ma'am.
Yes. So please introduce yourself so that we can just make sure that we can hear you.
Myself, ma'am, Dr. Ansari Sodia. Myself, Dr. Swati Asole from GMC Jalgaon.
Okay. So which set you want?
Set number 2.
Be loud.
Set number 2, ma'am.
Yes. Okay.
All the best. So, a 60-year-old postmenopausal woman presents with gradually progressive difficulty with side vision over 6 to 8 months and diplopia. So, vision is 6/9 both eyes, anterior segment and IOPs are normal. Your fundus picture is there. The left bottom picture shows the type of diplopia she's having, and left bottom right shows the MRI picture. I'll give you a few seconds to see the images. Yeah. So your time starts now.
Say pass or anything.
Binocular diplopia.
Okay.
Time is up.
Did you answer? Did they said something? Did they answer? I didn't hear what they said.
Ma'am, it was wrong answer. Yes.
Oh,
they
wrong.
answered.
Okay. Yeah. So this is the hemifield slide phenomenon, which is seen in patients with a complete bitemporal hemianopia. Okay. And the GCIPL analysis will show binasal thinning that's responsible for the bitemporal hemianopia. And in chiasmal compressive lesions, you get seesaw nystagmus. So if they gave one wrong answer, they should get -5. Is that right,
Yes,
Shilpi?
ma'am. Yes, ma'am.
Okay, fine.
The next team is Team 10. Team 10 is NS3 from KLE Belgaum.
Hello.
Hello, ma'am.
Yes.
Good afternoon.
I'll introduce.
Myself, Dr. Rohan.
Myself, Dr. Niveda, ma'am. We are from JNMC Belgavi.
Okay. So which set?
Seven.
Hmm.
Set
Seven.
number 7, ma'am.
Set number 7. Okay.
Right. So all the best. An 8-year-old boy who was operated for infantile esotropia at the age of 2 is seen for routine review. Vision is 6/6 in the right and 6/12 in the left. Cover test shows no shift on cover uncover, but a small 6 PD ESO deviation on alternate cover test. Stereo acuity is 3000 seconds of arc. I'll give you a couple of seconds to see the image of Bagulini striated glasses test.
There is ARC, ARC is there. Anomalous retinal correlation.
Okay, so your time starts
Yes.
now.
Ma'am, pass. Pass, ma'am. I'll go. Ma'am, diagnosis is that anomalous retinal correspondence. If it is a DVD or this thing, realistic.
So I'm afraid your time is up, but if you can tell me the third answer,
Yes,
I'll give you 2 seconds time.
Ma'am, we'll pass, ma'am, but I'll go with the first answer of anomalous retinal correspondence, ma'am.
Okay. So, unfortunately, I cannot accept that answer because this is a monofixation syndrome. And the best realistic outcome after infantile esotropic surgery is monofixation syndrome because bifoveal fusion is almost never achievable. So the best that you can get is that. In fact, it is desirable. And to know whether DVD and inferior oblique overaction coexist, you do alternate cover testing. And the elevation of the adducted eye, if it is greater than the amount of the hypodeviation in the other eye, then that suggests that both are present. So You get -5 for the first wrong answer.
So, thank you, ma'am.
Issue, we have other sets and MCQs also. Don't worry. So the next team is Team 1, Team Lumina from Chaitanya Eye Hospital, Kerala.
Hello, ma'am.
Hello.
Myself, Dr. Parati. I am Dr. Shehana, third year resident from Chaitanya.
Okay. So which set you want?
Set 4.
Set 4. Okay.
Okay, so all the best. This is a 28-year-old woman who presents with bilateral blurred vision for 5 days. She was treated last week for viral meningitis, for headache, neck stiffness, tinnitus, and fever. Vision is 660 both eyes. IOP is normal. We are showing the slit lamp of one eye, but both eyes appear similar. Fundus of both eyes you can see. Again, OCT is of one eye, but both eyes have a similar picture. I'll give you a couple of seconds to see the images. Okay, your time starts now.
Following a viral prodrome, VK syndrome next question. Maxillary layer detachment. Question.
Okay. So can we have the answers, please? Now, you have not really, you said VKH, but the question was not the diagnosis, it was the pathogenesis. So this is basically an autoimmune response directed against the melanocytes. And the OCT that distinguishes VKH detachment from other serous detachments is the presence of subretinal septae, which was there in this OCT picture. And the single most, in fact, that was the easiest of the questions, is sympathetic ophthalmia. Simply just take a history. And if there is no history of either a previous surgery or penetrating ocular trauma, that is the thing. So, Shilpi, the first one, she said something. Is that a wrong answer? Or
She said VKH only.
No, but that was not the question. The question
Yeah.
was the pathogenesis. So,
Another thing they answered is something, what you told, but that was not this.
that was not
Viral prodrome.
Viral prodrome.
that was not the question, actually. So,
-10 to them, ma'am.
yeah, okay.
The
All
next-
the teams, please read the questions properly. Some of them may not ask for a diagnosis. So read properly and answer.
Next
Yes,
team
yes,
is
go ahead.
Team 11. That is Team Eye Avengers from Arvind Eye Hospital, Coimbatore.
Hello.
Hello.
Ma'am, we are audible.
Yes.
My name is Khushi. And I'm Shrishti. We are from Arvind Eye Hospital, Coimbatore.
Okay. So which set you want?
Set 5.
Set 5. Okay.
Okay. So a 62-year-old woman with Fuchs endothelial dystrophy underwent DSEC in her right eye. On the fourth post-op day, she reports blurred vision. You can see the slit lamp photograph and the anterior segment OCT. I'll give you a couple of seconds.
Any clue? Graft. Sound.
Okay, your time starts now.
What's the name of the region? Ma'am, pass. Pass, ma'am. Ma'am, pass. Ma'am, pass. Why didn't see better? Ma'am, less tissue, like in Descemet membrane, and this is defect, so less tissue transplanted.
Okay. Can we have the answers, please? So since there is a the Descemet's membrane has got detached, a rebubbling, a re-injection of air is advised. And even without sutures, initially the air tamponade provides a mechanical apposition by driving out the fluid. And afterwards, the donor endothelium itself starts its action, and then finally, regular healing occurs. And actually, Deepak, you are partially right. It's because there is no stromal interface. So I think we can give that Shilpi. What do you say?
Okay, ma'am.
Yeah. Okay.
So plus 10 to
10.
them.
Yeah.
Yes.
Thank you, ma'am.
Okay. So with this, we end with the first 5 teams with the case-based round. Now it's time. एक मिनट तुषार अपने को ये इस पे जाना रैपिड फायर. Okay. So now it's time for the rapid fire round. So I invite Dr. Jaspreet, sir.
Thank you, Dr. Shilpi. Of course, the instructions are clear what it was, because you're going to have 40 seconds for those whole set of question and answers. So unless you say next or give an answer, we won't be moving on to the next question. So you're going to have 5 questions in one set. And unless you say pass or give an answer, we will not move. And you have total 40 seconds for those 5 questions and answers. So let's start with the first one.
So team 2. Team 2 is GBMC from Bundelkhand Medical College, Sagar.
Yes, ma'am.
Yes. So please introduce yourself.
Ma'am, I'm Dr. Ayushi Modi. Ma'am, Junior is from GBMC. She's logged in from the different devices.
But she can just switch on her video and.
Yeah. Okay, ma'am.
Okay. So which set you want?
Ma'am, set 7.
Set 7. Okay. Just a minute. So shall we start?
Yes, ma'am.
Sir, shall we start?
Yeah, can we have the first question, please?
Yes.
So what is the most common cause of light near
Pass.
dissociation? Next question. Which drug is most commonly associated with vortex keratopathy?
Ethambutol.
Next question, please. ADM,
Pass.
TSL. Next question. Leber's hereditary optic neuropathy usually causes what type of visual field defect?
Pass.
Next question, please. Salt and pepper fundus appearance is a classic feature of?
For first, can I give the answer?
Yes, go on. You have
For
time.
light near dissociation, sir, it is neurosyphilis and Addis pupil. And for sir, vortex keratopathy, amiodarone. For third condition, it is ectopia lentis. And sir, fourth is centrocecal scotoma. And fifth is congenital rubella syndrome.
I mean, these are all given after the time. So what do you do now? I hope they haven't put this thing into the AI. Suddenly, no, pass, and suddenly the answers are coming up.
Let's say for the second answer, definitely we are not going to give them the marks, because first they said ethambutol.
Ethambutol, yeah.
So, and the last they answered after the time. So we can give them, sir, 3.
Okay. That's
Initial
okay.
3.
Yeah, so the first answer is Argyle Robertson pupil seen in neurosyphilis. Vortex keratopathy, most commonly we see with amiodarone. ADM TSL4 is associated with subluxation of the lens, and usually these patients have keratopia, or which is known as essential, some kind of cataract as well. LHON, most common field defect is central or centrocecal scotoma, and salt and pepper fundus appearance is seen in congenital rubella syndrome. So had you answered them within the time limit, probably you would have got full marks.
So
be careful of
first,
be careful of the time, please. Yeah. Next.
So for the first, they said neurosyphilis first, and then she said Addis pupil.
Yeah, so neurosyphilis is the correct answer.
Okay, sir. Okay. So plus 25 to them. For the
Okay.
3
Yeah.
correct and the 1 wrong, second
One.
answer. Yes. Okay. So the next team in line is Team 5, the foveal focus from Yenapoya Medical College. Team 5, the foveal focus.
Good evening, ma'am.
Good evening.
I'm Dr. Sarah.
I'm Dr. Azna from Yenapoya Medical College.
Okay. So which set you want?
Set 5, ma'am.
Set 5.
Yes.
Okay.
We can start.
Yes.
Yes. So can we have the first question? Yes. So which uveitis syndrome?
Fuchs endothelium.
The timer.
Fuchs uveitis.
Okay, fine. The timer is not moving.
Timer is not. Okay, sir. Let's go. Let's go.
Timer.
Sir, it's not playing, but we can move.
Okay. What is the name of the angle between the visual axis and the optical center?
Pass.
Next question, please. In which condition do you see candle wax drippings on the retina?
Sarcoidosis. Sarcoidosis, ma'am.
Okay. Next question. Which muscle is the only extraocular muscle supplied by the ophthalmic artery, but not the muscular branches?
LPS.
Next question. What is the clinical name for? You can go for the answer if you read it.
Okay, time is up. We have already given you the extra time.
Okay, can we have the answers, please?
Yes.
So they were right. It was an easy question, probably. What they would be seeing day in and day out, Fuchs heterochromic iridocyclitis. The name of the angle between the visual axis and the optical center is angle alpha, not kappa. That's between the pupillary axis and the visual axis. In which condition do you see candle wax dripping? You were right, sarcoidosis. And the muscles supplied by ophthalmic artery, not by the muscular branches, superior oblique. And the name for the localized bulging of the sclera at the limbus between the cornea and ciliary body is intercalary staphyloma. So these are all staphylomas, but I wanted the specific name, which is an intercalary staphyloma. So how many marks do they score?
So plus 15, 2 correct and 1 wrong.
Okay.
Yes. So the next team is Team 3, that is Optic Warriors from AIMS Raipur. Optic Warriors.
Yes, ma'am. Good evening, ma'am.
Good evening.
Ma'am, I'm Dr. Priyanshi Pandey. I'm Dr. Bhavna Meena we are from AIMS Raipur.
Okay. So which set you want?
Set 2.
Set 2. Okay. So shall we start?
Yes, we can
Yes,
start
sir.
with the first question. Yeah. So in OCP, which specific component of the basement membrane zone is the primary target
Pass.
for antibodies? Next question, please. What's the most common condition associated with?
Pass.
Next question. Universal formula for IOL power calculation that handles everything, high myops, high hyperopes, without switching between different based on axle length.
Pass.
Next question, please. Which anti-VEGF has the highest binding affinity to VEGF?
Ranibizumab.
Next question.
Keratoconus. Keratoconus.
Okay, you can answer any of those if you missed. Time's up.
Time is up.
So we can have the answer. So the specific
Very
component of the basement membrane zone in primary target for antibodies is beta-4 integrin. And migraine is the most common condition associated with Alice in Wonderland. So it's an aura. So Alice in Wonderland is called an aura because the aura keeps on differing in size, varying. So that's how the book Alice is described in the book. The universal formula is the Kane formula, which is being now used at many places. I mean, it really gives good results. Anti-VEGF with the highest binding affinity to VEGF-A and also binds placental growth factor is aflibercept. And Rizuti sign, you were right, is keratoconus. So
plus 5 to them, sir.
plus 5. Okay.
So the next team is Team 9, the quiz waves from PGIMS Rohtak.
Good evening, ma'am. I'm Dr. Apoor. Dr. Rajat.
Be louder, please.
I'm Dr. Apoor, and this is Dr. Rajat from
Okay.
PGIMS Rohtak.
So with set?
Set 10.
Set 10. Okay. So shall we start?
Yes, we
Yes,
can have
ma'am.
the first question. So which orbital tumor is known for having chocolate cysts?
Pass.
Next question. What is the surgical landmark for entry of aqueous into the Schlemm's canal?
Blue zone.
Next question.
That's acceptable.
With which condition would you most commonly associate the flying saucer sign seen on OCT imaging?
Pass.
Next question. Which dystrophy is characterized by breadcrumb-like opacities in the stroma?
Pass.
Hurry up. Next question. You can take that. Which type of lens protein that increases significantly with age and nuclear sclerosis?
Ma'am, sir, we can answer for the first one.
You can take the last question, not the first one.
Which type of lens protein that signifies?
Okay.
Thanks.
So
Pass.
can we have the answers, please? Yeah.
Yes, sir.
Blue zone.
So the tumor having chocolate cysts is well described as a lymphangioma. The surgical landmark for entry of aqueous into the Schlemm's canal is the scleral spur. Which condition is associated with flying saucer sign on OCT? It's hydroxychloroquine toxicity. And the dystrophy characterized by breadcrumb-like opacities is granular dystrophy type 1. And the lens protein that increases significantly with age and nuclear sclerosis is the insoluble protein, which is a high molecular protein aggregate. So how many marks to this for?
-5 for the second question. I think rest they
Yeah,
passed.
okay.
Yes.
Yep.
The next team is Team 8, the Cup Disc Crew from AIMS Bhubaneswar. Team 8?
Yes, ma'am.
Yes, please introduce yourself and be louder.
I am Dr. Pavitra.
I'm Dr. Tejaswini, sir.
Okay. Which set?
Set 9.
Set 9. Okay. Shall we start?
Yes, ma'am.
Can I have the first question? So what is the drug of choice for treating acanthamoeba keratitis?
Pass.
Next question. Name the most common childhood intraocular tumor.
Retinoblastoma.
Next question. What is the eponym for the iron line seen at the base of the cone in keratoconus?
Pleasure line.
Next question. Which type of retinal detachment is associated
Exudative.
with... Next question. What is the Goldman tonometer prism diameter?
Pass.
PHMB.
PHMB. First one is PHMB.
Last time is
Okay.
up.
Yeah. I think they got quite
4
a lot
correct.
of them right. Yeah. So they were right. The first answer is PHMB. And I think they were easy questions. Probably the set was quite easy. The name the most common childhood intraocular tumor is retinoblastoma. You are right. It's Fleischer's ring. Obviously, exudative RD would have a shifting fluid. And the one tough question was the Goldman tonometer prism diopter. That is 3.06 millimeters. So they got 4 correct.
Yes, sir. So the last team to play this rapid fire set is Team 6, that is Phoenix Petals.
Good evening, ma'am.
Good evening.
I'm Khushi. I'm Suprita. We are from Shankar Eye Hospital, Coimbatore.
Which set?
Set 3, ma'am.
Set 3. Okay, all the best.
So we can have the first question. Yeah. Name the procedure where the levator aponeurosis is tucked or reattached to the tarsus.
Pass.
Next question. What is the target intraocular pressure reduction recommended by the ocular hypertension study?
Pass.
Next question, please. What is a characteristic OCT finding in a patient with acute macular neuroretinopathy?
Pass.
Next question. Which orbital bone is most commonly involved in a blowout fracture? You have to name the bone.
Maxillary.
Next question. Now see the finding here where the ring is most commonly due to fracture. You can take that. The finding is most commonly due to fracture of which orbital wall?
Which one?
Which is the finding? You need to tell the finding.
This is the finding, and it happens due to fracture of which orbital wall?
Yes.
Okay.
So the first answer is levator resection, where the epineurus is tucked or reattached to the tarsus. The target IOP reduction recommended by the study is 20%. The characteristic OCT finding in patients with AMN is acute macular neuropathy retinopathy is hyperreflective bands at the outer plexiform outer nuclear layer interface. And the orbital bone, you were right, it's the maxillary bone. The finding most commonly, this is known as orbital emphysema, is due to it basically results from fracture of the medial orbital wall. So basically, it's the medial wall. You see a lot of inferior fracture, but you don't have these things. So it's the medial wall in correlation with the ethmoid, basically, that causes this emphysema. So how many?
Plus 10. Plus 10.
Plus 10.
Yes.
Thank you.
So with this, we end with the one set of case-based round and one set of rapid fire round. Now it's time for second set of MCQs. So I again request Dr. Purvi ma'am to please conduct the next.
Yeah, please continue and all the best again. So the first step MCQ is the color of fluorescent staining in corneal ulcer is. Options are A, yellow, B, blue, C, green, and D, royal blue. And the time starts now. Okay, the time is up. And so answer is, it is green. Basically, the dye itself is orangish yellow. It's a hydrophilic dye, which you examine under cobalt blue filter. And what you see ultimately on the cornea is a greenish hue. Okay. Next, please. Blood vessels in a trachomatous spinous lie. A, beneath the Descemet's membrane. B, in the substantia propria, that is the stroma, between the Bowman's membrane and stroma, or between the Bowman's membrane and epithelium. And the time starts now. Okay, so the time is up, and the correct answer is it lies between the Bowman's membrane and the epithelium, right? So these vessels are basically superficial vessels, and they arise from the vessels of the conjunctival limbus, and sometimes they can even appear to replace the Bowman's membrane. That's a superficial pannus. Next, please. 11 months child weighs 8 kgs and has Bitot spots in both eyes. So what would be the most appropriate vitamin A schedule for this child? Options are A, 2 lakh units on days 0, 1 and 14. Option B, 1 lakh unit days 0, 1 and 14. Option C, 2 lakh units on days 1, 2 and 14. And option D, 1 lakh units on days 1, 2 and 14. And the time starts now. So the time is up, and the answer is option B, right? The schedule is days 0, 1 and 14, and less than 1 year, the dose is 1 lakh units, right? Next, please. IUL master uses the principle of, name the principle. A, Schemflug principle. B, coherence interferometry. C, linear polarization. Or D, Fraunhofer diffraction. And the time starts now. And the correct answer is IUL master is basically a low optic coherence interferometry. Schemflug is used in the pentacam, linear polarization is used in the GDX, OCT, polarized glasses, and the diffraction is used in many optical systems, lasers, and the prisms. Next, please. The latest version of disease classification system which has been developed by WHO is ICD-8, option B, ICD-9, option C, ICD-10, and option D, ICD-11. And the time starts now. Okay, so the correct answer is, it is the International Classification of Diseases 11. It is more digital instead of the earlier paper-based versions, and it is now also multilingual. This is the most current one, and it came into effect in 2022.
So with this,
Thank
we
you.
end with the second set of MCQ round. And now it's time for a small commercial break. We thank the His Highness team for the continuous support. And this is a small ad from their end. So remember, our next semi-final, that is semi-final 2, will be on next Wednesday, that is 6th May at same time, 7:30 p.m. with new quizmasters and new teams. Sorry, I forgot to just display the slide of Dr. Jaspreet sir. So he is a professor in pediatric ophthalmology and strabismus and neuro-ophthalmology division at PGI Chandigarh. He's trained at Great Ormond Street Hospital, Moorfields Eye Hospital, King's College Hospital, National Institute of Neurology and Neurosurgery, London. He is the past president of Chandigarh Ophthalmological Society, Joint Secretary Strabismus and Pediatric Ophthalm Society of India, ex-Joint Secretary of North Zone Ophthalmological Society, ex-member Managing Committee AIOS and ex-secretary of Chandigarh Ophthalmological Society. He has more than 120 publications in peer-reviewed index journal with each index of 20 and have also contributed various chapters in the book. And these are the various honors and awards to his credit. So with this, we move on to the, we'll start with the case-based set again. So I invite Annapurna ma'am for the same.
Yeah.
So the next team is Team 8, that is Cup Disc Crew for the case-based round. Shall we start?
Yes, ma'am.
Which set you want?
Set 12.
Set?
12.
1. Okay.
12.
12.
12, 12.
Set 1 is remaining now. Okay.
Yeah, so a 26-year-old woman at 12 weeks of gestation presents with blurred vision and floaters in her left eye for 5 days. Vision, right eye normal, left eye 6/24. Serological testing shows a positive IgG and a negative IgM. So I'll give you just a couple of seconds. Your time starts now.
Toxoplasmosis.
Pass.
Pass. Second one, treatment is needed.
Time is up.
Okay. So, see the question, I said again, read the question properly. The question was not the diagnosis. The question was, what is the risk of fetal infection? So, since there is no IgM, okay, it indicates only reactivation, not a new infection. So, the fetal reaction is nil. Therefore, I don't know, Shilpi, do we give it as a wrong answer or
Yes,
not
ma'am.
answer? Wrong
Wrong
answer.
answer.
Okay.
Yes,
Yeah.
ma'am.
So the second one, you were partially right. You said treatment is indicated. You did not answer the second part, so we can give you half the marks. We
Yes,
can
ma'am.
give you +5. And the third one you did not answer. Now, treatment is indicated in this particular patient because it's within very close to the fovea. And since she's only 12 weeks, we cannot give her pyrimethamine. So a local treatment with intravitreal clindamycin and dexamethasone is the ideal in this particular patient. Spiromycin, again, is not indicated because there is no risk of fetal transmission. So, yeah. So, -5 +5 cancel each
Yes.
other.
Yeah.
And finally get 0 ultimately.
Zero. Yes, ma'am.
Okay.
The next team is Team 3, that is Optic Warriors from AIMS Raipur.
Yes, ma'am.
With set?
Set 3.
Set 3. Okay.
Okay. So a 35-year-old man presents with nyctalopia since childhood and progressive peripheral field loss over 5 years. He can still read fine print. Vision is 6/9 both eyes. The fundus picture is given. There is a pedigree chart. I will give you a couple of seconds to.
Can we start, ma'am?
Yeah, start.
Retinitis pigmentosa. Pass. Pass. ERG investigation.
Condition. Okay.
What did you say for the investigation?
ERG.
Yeah.
ERG. Okay, fine. Right. So now your diagnosis is wrong. This is not retinitis pigmentosa. There is no bone spicule pigmentation. And the pedigree chart clearly shows an X-linked condition. And if you see, the patient is 35 years old. So if it was RP by 35, the patient would not be having the kind of vision that was told in the stem. And choroideremia, the genetic defect is a mutation on the CHM gene. And the imaging modality best help to monitor the progression is fundus autofluorescence. You can see the expansion of the hypoautofluorescent area. And another condition is gyrate atrophy. And the single investigation that differentiates is serum ornithine level. Okay. So diagnosis is wrong. You get -10. Second one is 0. Okay. Third one, you mentioned ERGs. That is half the answer was wrong. So I'd say -5. What say Shilpi?
Ma'am, first is -5 because it's negative is
Oh,
-5.
I'm sorry.
Yeah.
-5. Yes. So this, how do you do for the third one? Half is wrong. I don't know.
-2.5 then.
Yeah, -2.5. So total -7.5.
Yes.
Right.
So the next team is Team 5, foveal focus. Team 5, foveal focus.
Yes, ma'am.
Yes. With set?
Set 10, ma'am.
Set 10. Okay.
Okay. So a 38-year-old woman presents with gradually worsening blurred vision in her left eye for 1 year, typically worse on waking and improving during the day. Right eye vision is normal, left eye is 6/12. IOP is normal in both eyes. Right eye examination is normal. Systemic examination is normal. Now you can see the clinical picture on the bottom, right eye and left eye. The top, the left is the specular microscopy. The middle shows the slit lamp of the involved left eye. and the right shows the UBM of the involved left eye. I'll give you a couple of seconds.
Can you start, ma'am?
Yeah, go ahead.
Pass, ma'am.
Half. I see syndrome.
Syndrome.
Okay. So the time is up.
So actually, yeah, okay. We'll give them for the first one, eye syndrome. We can give them the correct answer. The second was a similar condition is Axenfeld rigor. The main differentiation being that ice is unilateral, acquired, and no systemic features. Everything is the opposite in Axenfeld rigor. And corneal edema in these people, partly due to raised IOP, partly due to the abnormal or ice cells. So they get plus 10.
Yes.
Yeah.
The next team is Team 9, the quiz waves.
Good evening, ma'am. I'm Dr. Apur and Dr. Rajat.
With set?
9. Set 9.
Okay.
Okay. So a 44-year-old man is referred for a suspicious fundus lesion found incidentally during routine examination. He is asymptomatic. Vision is 6/6 in both eyes. The thickness of the lesion by B scan is 1 millimeter. You can see the fundus picture below and the late phase fundus fluorescent angiogram on the top. I'll give you a couple of seconds. Yeah, your time starts with.
Pass. 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 Pass.
Okay, so you didn't answer anything, so we can't give you marks, but here are the answers. So this is a choroidal nevus. Basically, you see a pigmented lesion with overlying drusen, okay? And there is hyperfluorescence from the drusen, but there is no leakage. And the B scan thickness is only 1 millimeter. Therefore, all this favors a benign nevus. If it were a melanoma, the most common site is the liver. And the strongest predictor is a BAP1 mutation or monosomy. The 5 factors, see, 5 factors, the original factors were clinical factors as well, but this question specifically asked as determined by multimodal imaging. So, by Dr. Carol Shields has given these features: thickness greater than 2 millimeters by B scan, OCT showing SRF, fundus autofluorescence showing hypofuscin, B scan showing melanoma hollowness, and fundus photography showing a basal diameter greater than 5 millimeters. So you don't get anything for this.
So the two teams are remaining. The next team is Team 2, GBMC.
Yes, ma'am.
Which set?
Set 11.
One is also remaining because of the confusion, we didn't get this. I mean, to set 11. Set 11?
Yes, ma'am.
Okay.
Okay. So a 1-month-old girl is seen with the following presentation. Your time starts now.
Sturge-Weber syndrome. Next. Pass. What is that? Pass.
Okay, right. So unfortunately, your diagnosis is wrong. This is an infant. See, in a Sturge-Weber, you get a port wine stain. This is an infantile capillary hemangioma. The syndrome you need to exclude as a phase syndrome with certain features. And to rule out that, you have to do MRI brain or MRA. And the first line treatment is oral propranolol. Only if the lesion is very thin and very small, you can give topical timolol. Otherwise, oral propranolol is the first line. And main thing you have to warn them about, one is about hypoglycemia, second is about bronchospasm, and the others that are given there. So you get -5 for the wrong answer.
Yes.
Yeah.
So the last team is team 6, Phoenix Petals, for this case-based round.
Set 13, ma'am.
Set 13. Okay.
Okay. So we have here a 45-year-old woman presenting with gradual progressive vision loss in her right eye over 18 months. Right eye vision 636 with an RAPD, left eye normal. You can see the right abnormal fundus below. You can see the MRI above. I'll give you a couple of seconds. Yeah, your time starts.
Pass. Pass.
All pass.
Okay, so this is an optic nerve sheath meningioma. The optociliary shunts were there in the fundus, and the tram track sign was seen on the MRI. Classic triad being progressive visual loss, optociliary shunts, and optic atrophy. And in this particular case, very small, you probably can leave it alone. But since the patient already has an RAPD, this lesion is progressing. So radiotherapy, this is only a benign tumor, but the radiotherapy is to arrest the growth of the tumor and to preserve whatever remaining vision is there. Okay. So you get 0 for this.
They passed all.
Mm.
So now it's time for the rapid fire round. So we start with Team 10.
Team 10, ma'am. Okay.
Yes, ma'am.
So which set?
Bol.
Set 1, ma'am.
Set 1. Okay. So shall we start?
Yes, ma'am.
We can have the first question.
Yes, sir.
So what is the eponym for the orange-red spots seen at the level of RP in pseudos and
Pass. Pass, sir.
Next question. Which glaucoma medication is most commonly associated with deepening of the superior sulcus?
Deepening of superior sulcus. Pass, sir.
Pass, sir.
Next. What is the surgical procedure of choice for a child with congenital glaucoma and a cloudy cornea?
Sir, GDD.
Child.
Goniotomy, sir. What goniodystrophy? Pass, sir.
Okay. Which corneal dystrophy is associated with TGF-B1 gene?
Pass, sir.
Pass, sir.
Next question. So, okay, you can take this. Yeah. An elderly patient has a non-healing ulcer on the lower eyelid with occasional bleeding. What is the diagnosis?
Muren's ulcer, sir.
Can we have the answers, please? Yeah.
Nodular.
Yeah. So the answer for the orange-red spots is POD orange. The glaucoma medication associated with deepening of the superior sulcus is all the prostaglandin analogs. Surgical procedure of child with congenital glaucoma is goniotomy or trabeculotomy. I don't know why you said pass after giving the answer.
Sir,
Which
I
corneal?
think
Sir, I think pass the fourth one, sir.
They passed the fourth one, sir.
Yes, sir.
Okay.
Third the answer.
Third the answer. Okay. Okay. So which corneal dystrophy is associated with TGF-B1? It's granular or the lattice dystrophy. And this is a nodular basal cell carcinoma of the lower lid.
10 minus 5, 5. 5
Five.
minus
Yes,
6.
Thank you, sir. Thank you, ma'am.
Thank you.
Calculated. So the next team is team 1. Lumina.
Yes, ma'am.
So which set you want?
Set 8.
Set 8.
Yes, ma'am.
Okay. Shall we start?
So before
Yes,
we go
ma'am.
on, I just want to tell the participants that you can answer even when I'm reading the question, you can just read it and answer. Don't wait for me to complete the question because otherwise the time can be short for you. Okay, so you can do whatever you want.
Okay.
Yeah. So let's start have the first question, please. Yeah. Which condition presents with bone spicule pigmentation and arterial attenuation?
Retinitis pigmentosa.
Next question, please. What is the most common secondary complication of a long-standing total retinal detachment?
Pass.
Next question. Name the law which describes the eye's 3D spatial orientation. Yes or no? Your
Pass.
time is running out. Next question. With which condition?
Pass.
What did you say?
Pass.
Pseudo exfoliation.
Okay. Which cranial nerve palsy causes
Pseudo-exfoliation.
down and out?
Sambolism and pseudo-
Okay.
So what is the answer for the last question?
Third nerve
Okay.
palsy.
Okay.
Okay.
So can we have the answers, please?
Yes, sir.
So the first question was quite easy. It's retinitis pigmentosa. So the end stage of a long-standing retinal detachment is phthisis bulbi. The law which describes the eye's 3D spatial orientation is Donder's law. So you know about Herring's law and you know about Sherrington law, and this is the Donder's law, which is it. So Sampoli's line is associated with pseudo-exfoliation. You were right in that. And down and out deviation of the eye, position of the eye seen in the third cranial nerve palsy, and that was correct.
So plus 30 to them, sir.
Okay.
Yes. So the next team is Team 7. Jalgaon Avengers.
Yes, ma'am.
Yes. So which set?
Set 11.
Set 11. Okay. Shall we start?
Yes. So the first question is, name the clinical syndrome which comprises of unilateral glaucoma, iris atrophy, and iris holes.
Iridocorneal endothelial syndrome.
Say pass or anything.
Pass or what?
Iridocorneal endothelial syndrome.
Okay. Second question, which stain is used to identify ocular amyloidosis in specimens? Your time is running out.
Congo red.
Which laser wavelength is typically used in PDT? I think the time's up.
Time is up. You can attempt the questions, but we will not give you the marks.
What is the double ring sign pathognomic for?
Pass.
Next question. So which syndrome is associated with extension of eyebrows to the midline? They go inside. It's called cyanophores. Okay, can we have the answers, please?
Yes, sir.
So they did yeah. So the first answer is essential iris atrophy or the eye syndrome. The stain which is used for ocular amyloidosis is the Congo red. The wavelength typically used in PDT is 689 nanometers. The double ring sign is pathognomic of optic nerve hypoplasia. And the syndrome which we are seeing here usually is the Cornelia de Lange syndrome. And this is called the cyanophores, which is extension of the eyebrows to the midline. So how many marks do we
Plus
they have?
20 for the first and the second answer.
Okay, plus 20.
Yes. So the two teams are remaining. The next team to play is Team 11. That is Avengers from Arvind Eye Hospital.
Hello, ma'am.
Hello. Which set?
Set 4.
Set 4. Okay. Are you ready?
Yes, ma'am.
Okay, great.
Let's have the first question. Yes. What is the eponym for the
Pass, sir.
Next question. Which organism is the most common cause of delay?
Propionobacterium.
Next question. Name the phenomena where a patient sees moving objects as a series of stills.
Pulfrich phenomena.
Next question. What is the most common cause of spontaneous vitreous hemorrhage in adults?
Pass.
Next question. Which condition should you suspect based on the clinical sign? So he has a lot of ecchymosis here and the lower lid, both eyes. So what would you suspect?
The fourth trauma, maybe.
Like what
Anterior
condition?
cranial fossa fracture, like fracture of the cranial fossa.
Okay.
So, yeah. So our first answer is the eponym for pre-retinal loops is called C-fan neovascularization. Your second answer, which organ is the most common cause of delayed onset chronic endop, was right. It's Propionibacterium acnes. The new name is Cutibacterium acnes. That's right. Name the phenomena where a patient sees moving objects as a series of stills is known as palinopsia, not Pulfrich phenomena. That's something different. What is the most common cause of spontaneous vitreous hemorrhage in adults is proliferatic diabetic retinopathy. And these are, if you have seen a raccoon, probably these are known as the raccoon eyes. And it's a skull base fracture. Okay, not a posterior fossa fracture. That's a very vague answer. So it's a skull base fracture.
So plus 10 minus 10.
Yeah, so
0.
0 marks.
So the last team is team 4. That is Visionaries from KMC Mangalore.
Yes, sir. Set 6.
Set 6?
Yes. Yes.
Okay. So shall we start?
Yeah,
Yes, done.
Yeah.
Okay.
So the first question is, what is the classic visual field defect in a patient with a lesion at the junction of optic nerve and chiasma?
Junction of the bitemporal hemianopia.
Next
It's
question.
optic nerve and chiasma, not such a morning glory optic nerve.
Name the
Pass.
next. Which refractive surgery uses a femtosecond laser to create a lenticle that is then removed?
Classic flaps. Pass.
Next
Smile.
question.
What's it?
What is the term
Sir,
for what is the term for paradoxical constriction of pupil in the dark?
pass.
Next
Sir,
question.
answer for 3 is smile.
So the time's up. So what answer did you give for 3?
Morning
Smile.
glory syndrome. 3 is it smiles.
Yeah. So there.
So
Yeah.
first is one eye will be like full. There will be no visual field, and other eye will have a scotoma.
So what's that called?
Um,
We aren't going to mark you for this.
non-congruous. Yeah.
No, but you've given a wrong answer initially.
Yes. Initially,
So
they were discussing. She was right actually. The other one get the wrong answer.
Yeah, finally they settled on bitemporal, but it's a
Yes.
junctional scotoma, and you're right, what you are describing. So name the congenital condition with the morning glory optic disc and basal encephalocele is a moya disease associated. The third answer is was simple enough. I mean, it's a femtosecond laser is just a smile procedure. The term for paradoxical constriction of pupil in darkness is called the pupillary escape or the reverse APD. And the name of the sign, obviously you did not answer the last one, where the conjunctival folds over the lower lid margin in lymphoma. These are called Salmon patches.
So plus 5 to them, sir. Minus
5.
5 for first question and plus 10 for the third question.
Third question, yeah.
So now we are over with all the sets of case-based and rapid fire rounds. So now it's time for the last set of MCQs by Dr. Purvi ma'am.
Yeah, please. So gender is which type of a variable? Options are A, is it a nominal variable? Option B, ordinal variable. C, cardinal. Or D, continuous. And your time starts now. And the answer is, it is a nominal type of a variable because order is not important and cardinal and continuous are basically numerical type of variables. Next, please. For medium-sized patterns, the peak contrast sensitivity would be at option A, 2 to 5 cycles per degree, option B, 6 to 10 cycles per degree, option C, 20 to 40 cycles per degree, and option D, 50 to 60 cycles per degree. Your time starts now. And the correct answer is, it is 2 to 5 cycles per degree. Finer the patterns, more would be the contrast that would be required. Okay. Next, please. The change in stimuli perception while moving from scotopic vision condition to photopic vision condition is best explained by option A, Purkinje shift, option B, photochromatic interval, option C, visual adaptation, and option D, biphasic threshold. The time starts now. And the correct answer for this is it is a Purkinje shift, right? When you move from a daylighted to a dark conditions, photochromatic interval is the least threshold that is required to start perceiving a color. Visual adaptation is just the adaptation as you move from different visual stimuli and lighting and color conditions. And biphasic threshold is when you change from one visual stimulus and illumination to another. Okay. Next, please. Paradoxical diplopia observed after strabismus surgery in a formerly esotropic patient is most likely caused by option A, surgical undercorrection, option B, eccentric fixation, option C, surgical overcorrection, and option D, persistence of ARC, abnormal retinal correspondence. And the time starts now. The time is up, and the correct answer for this is persistence of ARC. That will lead to continued diplopia. The last one. What is the cause for this appearance? You can see the image. So what is it known as, or what is the cause? Option A, it's a congenital abnormality. Option B, it is because of trauma. Option C, it is because of uveitis. And option D, it is surgery induced. The time starts now. The time is up. These are basically epicapsular stars. They are congenital abnormalities. They are very benign star-shaped pigmented deposits, and they are remnants of the tunica vasculosa lentis. Right. That is all. Yeah, thank you.
Thank you. Thank you, Dr. Purvi ma'am, for this wonderfully taking us through this. I welcome all the quiz masters to just get the video as well as audio on. So, friends, it was a great show. Thank you, all of you, Dr. Jaspreet, Dr. Annapurna ma'am, and Dr. Purvi ma'am, for wonderfully taking us through this such a interesting and making those quiz so interesting as well as a learning experience. Thank you. Thank you once more from the bottom of heart. So, we would be having some private practitioners who have participated today. Until their results are computed, we have some time to chat with few of the mentors who have taken an efforts to log in. Can I request the Sai to just upgrade the people, attendees who are who are the mentors? We can have a small chat with them, have some feedback from them so that we can improvise.
Mentors, I kindly request to raise your hands on Zoom so that I can promote you as a panelist.
Please raise your hands. We are having 31 participants. Are they the private practitioner category then?
Yes, doctor. I am just retrieving the top 5.
Okay, okay. So till we get those, let's have some chat with a few of the team members who are there. Yes, all the team members who are there still logged in. Can you get your videos on? We will have a small informal non-ophthalmic chats with them. Yeah, so team GBMC, where are you from? Where is your partner?
So she's on DRP right now.
Okay, so do introduce yourself once more for the sake of all audience as well as quiz masters, and how did you ever become familiar, and how did you register for this particular quiz?
So I am Dr. Ayushi Modi, PG resident 3rd year, Government Bundelkhand Medical College, Sagar. Sir, first time we registered in first year, our SR told about this quiz. So from that time we are following big queue.
So now you are a final year resident?
Yes, sir.
Okay. So does it help you in your regular studies, or why do you spend extra time in almost 1.5 years for 13 episodes? So what do you gain out of it? Just a feedback from you.
सर क्वेश्चंस मतलब जो पढ़ने का बहुत ऐसा रहता है कि अच्छा ये नहीं बना था तो सर गो आई गो बैक एंड लुक अबाउट दैट पर्टिकुलर सेगमेंट कि ये क्यों नहीं बना था.
Okay, good. Okay, thank you once
Thank you
more,
so much, sir.
and best wishes to your partner also. So we can have some chat. Jasprit, you can have a small chat with Team Lumina. Please introduce yourself. Professor Jasprit will interact with you.
Hi, I'm Parvati.
Once, just
I am
1 minute. I will just hold on. We will have a small chat with you. Meanwhile, we have the top 5 private practitioners who are there. Their numbers are displayed on the screen. If you are present and still logged in, request you to raise your hand so that we can, after having small chat with these team members, we will have a small chat with you. And the audience will also like to know who are the private practitioners who have been repeatedly participating and making money out of Big Q. So now you can unshare the screen, Sai. And if they raise their hands, do get them on the screen as a panelist. Yeah.
Yes.
Come on.
So go ahead.
Please.
Yeah. So, yes.
Yeah, hi, I'm Dr. Parvati, third year resident, and this is Dr. Shehana, again third year resident from Chaitanya Eye Hospital, Trivandrum.
From Trivandrum. Okay. So, what did you find interesting in this, and how is it going to help you in the future? And do you think you will participate again? And what extra you want to do? I mean, for this.
It was actually very informative for us because we are going for our final year exam. So we have our OSCEs and practicals again. So this was very useful for us since we could brush up on our ophthalmology chapters very well.
So, how did you prepare for this? Yeah, go on.
We actually saw many previous videos of the same quiz and many other quizzes, and we also brushed up through our chapters and textbooks.
Oh, so you see a lot of online videos also and tutorials for all this.
Yeah.
Okay. So were there any repetitions? Did the quiz masters repeat few questions?
Not likely because there were different questions, but based on the same chapters. Yeah.
Thank God. Annapurna ma'am, all credit to Annapurna and Shelby for helping us out in seeing that we are not repeating the things. Thank you. So Team Lumina, thank you. Keep participating. And at the conclusion of, second semi-finals, we will be letting you all know who are the top 10 teams who are making it into the finals. Okay, best of luck till then.
Thank you.
Team Avengers.
Thank you, sir.
We have Team Avengers. We can have
Good evening, sir.
Madam, Purvi Madam, इनसे पूछिए ये
Yeah. Yeah, so introduce yourself again once, your name.
I'm Shrishti, ma'am, from Arvindai Hospital. I'm Kushi.
Okay. So what has your experience been, and assuming the scores for today, what do you think you'll be going forward to the finals now?
Ma'am, yes, that we don't know. Ma'am, but we actually, so we had a little doubt. Like, can I just ask, if one of the rapid fire questions?
No, that we will be dealing later on only.
Okay, sir.
No, it's a non-ophthalmic, non-quiz.
Yes. Yes.
So I would like to ask here, if your partner takes a wrong decision or gives a wrong answer, then what do you feel? After this session, what is going to happen?
Ma'am, actually, we are first year, 4 months into Optal.
Oh,
So
okay.
this was the
4 months.
first time we started studying Optal. So it was a great journey. Like, we have done all the videos. First time we are understanding how to read OCT, how to see gonio. So it was wonderful for us from previous year videos and everything. So we
Okay,
both
this
are
is
posted in different peripheries. But then we come for every quiz, we have come to the same place, given the quiz. So it was wonderful for us. It's a very non-boring way of studying everything, I feel like. Like, because you're like going through videos and questions, so you just never get bored because it's something new and something different every question. So Yeah, so it was wonderful.
Good,
This
good.
is wonderful. A big credit to you, Dr. Prashant. That first
Yeah.
4 months into Ophthal and they are
No,
into the
ma'am, 1 year,
semi-finals.
4 months.
As a 1 year, 4 months. Okay.
Second year. But still, it was
Still,
very
yeah.
Quite a
Well
thing.
done, well done.
In fact, madam, all that credit goes to three of you, all the quiz masters who help us out with doing it. You are the people who add spice to it. The knowledge can be given bland by having a monologue, but a quiz is a different way, interactive way of learning,
Yes.
and it is more spicier that people consume it in a big way. That's why we had 250
Definitely.
plus teams, so we are happy with them. Any other team? Thank you, Team Avengers, and best wishes to you as well for
Thank you,
your
sir.
future as well as for the next episode as well.
And you
Thank you,
have big
sir.
prizes also.
Yeah,
A big incentive.
exactly.
But now you need to think about the quiz masters as well. A small something small for the quiz masters.
Of course, done. We take that hint, ma'am. It will be done. It will be done. Yes, we will be taking care of it. So we have any other teams for the team Fovial? Are you there with us? Can you get your video on? Team Lumina. Acha, we had a chat with Team Lumina. Any other teams? Okay. Okay. So from private practitioner category, we have Vinith. Vinith, can you get your video on? Vinith?
Yeah, hi sir.
Hi. So you again are into that private practitioner category. If I'm not wrong, this guy got married few weeks back, and at this hour he's with us. So any
No,
problem?
I didn't get married. That was my Roka ceremony few days back.
Okay. No, but still this time should be with someone else, and you are spending 1.5 hours out of that here. उधर कुछ गड़बड़ तो नहीं है?
नहीं सर, सब फर्स्ट क्लास है.
Okay, just pulling. So जसप्रीत, ये बंदा आरपीसी में सीनियर रेसिडेंट है, पूछे इन्हें कुछ.
क्या पूछना है? So which like किस स्पेशलिटी में कर रहे हो वहाँ?
सर मैं रेटिना में था. मैं एसआरशिप ended last month, so now I have joined as a consultant with ASD hospitals.
Okay, so you've done 3 years retina.
Yes sir.
विनीत,
Yes
सुनाई
sir.
दे रहे हैं? भाई एक नॉन ऑप्थेल्मिक क्वेश्चन है. हाउ डू यू बैलेंस बिटवीन स्पेंडिंग टाइम हियर वर्सेस स्टीलिंग टाइम फ्रॉम हर राइटफुल टाइम?
नहीं, actually she is very she is cooperative and understanding.
She's like what, anterior segment or what?
No, she is a dermatologist.
Oh, she's a dermatologist. ठीक है.
चलो, गुड
सही
गुड
बात
गुड.
है. तो उस ध्यान से रहना, नहीं तो चमड़ी उधारेगी और क्या.
चलो, congratulations Vinith, and our
Very
best
well.
wishes
Good,
from
good.
team
Yes.
Brain
Very well
Teasers
done.
for your future life as well, and we hope all our quiz masters get necessary invite for the रोका के लिए. तो मुझे थोड़ा बुरा
Sure.
लगा था जब फोटो देखा फेसबुक पे कि यार विनीत ने याद नहीं की, पर अब भाई आई स्टिल हैव एन होप कि वी विल गेट एन इनवाइट.
Yes, sure.
चलो, बेस्ट ऑफ लक.
विनीत, कैसे लगे आज के क्वेश्चंस? एक्सेप्ट ठीक है, ये तो एमसीक्यूज तुम लोग प्ले करते हो, बट
नहीं,
बाकी
मैंने पूरा क्विज अटेंड किया था, मतलब
हाँ,
रैपिड
नहीं
और
वो
वो.
नहीं बोल रही, बट रैपिड फायर एंड केस बेस्ड.
हाउ वाज
हाँ,
इट?
मतलब द बेस्ट पॉइंट इज कि देयर इज नो रिपीटिशन. मतलब लाइक सिंस क्वार्टर फाइनल से आप लोग ये रैपिड फायर कर रहे हो, एंड ऑलमोस्ट अगर आप देखो तो 80 टीमें वहां पे आपने अटेंड करी, 20 अब 100, 100 into 5, तो 500 यूनिक क्वेश्चंस बनाना अपने आप में इट इज क्वाइट अ बिग अचीवमेंट. तो हार्डली 1 या 2 रिपीटिशन मैंने पिछले पूरे 5 एपिसोड्स में देखा. तो इट्स मतलब लाइक इट्स हेड्स ऑफ सर, मतलब जो जिस लेवल का क्विज आप लोग कंडक्ट कर रहे हो.
Thank you Vinith. It's quite flattering. And
नहीं,
it's your color.
actually.
Thank you once more, Vinith.
Thank
Any
you,
other people from other teams right now with us? Team Visionaries, are you there? Okay. Team NS3. Team NS3, yeah, come on.
Sir, firstly, I would like to thank you and ma'am for
First,
hosting
introduce
this.
yourself. First,
Sir,
introduce.
myself, Dr. Rohan. Yeah.
I'm Dr. Niveda, sir.
We are from.
The photograph.
Yeah.
Now, yeah.
We are
Please.
from KLE, Belgaum, sir. This is the first time we are attending this, and was like very unique and nice for us to attend. And firstly, sir, like for you and ma'am, it is so good. And we have been watching AP Pearls. Like I sleep by watching AP Pearls. So thanks to ma'am. Jaspreet sir, तो I've been watching his videos also. इधर उधर का conference videos. And Bhagat ma'am ka MCQs was easy, but it was nice as a rehearsal. I think that was my feedbacks. Then
Thank you.
Yes.
And let her speak as well. Otherwise,
Very
take
good.
it.
This is also my first experience participating in quiz. And it was nicer actually. Not the questions were not repeated and case based was very nicer.
Very difficult,
Very
but
difficult, but it was first.
nice.
You are in semi-finals.
Yes, yes, ma'am. Yes, sir. Yes.
Good.
If you
Congratulations
found
once
Thank
more.
you.
case based difficult,
Yes.
supposing tomorrow your juniors asked you,
Yes, ma'am.
what advice would you give them to approach such case based or rapid fire? What would advice would you give to your juniors in the future?
Ma'am, right now we had seen that essential infantile esotropia patient just 1 week ago. So I had actually revised that topic and it was very useful for me. But the thing is, I got confused here and there with ERC and this thing. So maybe that is where I got confused. And it really helps, ma'am. On that day when you see that patient, then you should just read about it. Then like that way we remember and we are like, oh, okay, we saw this that. I think that would be my advice to all the juniors or in this thing.
Good.
Yes, ma'am.
Great. Congratulations and best of luck.
Thank you, sir. Thank you, ma'am.
See
Thank you,
you in
ma'am.
the finals shortly.
Yes,
Okay.
thank you, ma'am.
The team Foveal
Yes.
Focus. Are you there with us?
And visionaries.
And Visionaries, team Visionaries. I think they have okay there. They're shying away, or I don't know why they are not there. Beat. So I think it's time for us to say goodbye to everyone. So first semi-finals, we are through with it, and following Wednesday, means coming Wednesday, we will be again meeting at same time, that is 7:30 p.m. with the second semi-finals. And for the first as well as second semi-finals, after second semi-finals, a day or two later, we will be declaring who are going to be the top 10 finalists. Till then, it's time for us to say bye-bye. Thank you, Purvi ma'am. Thank you, Annapurna ma'am. And thank you, Jaspreet. I really had to push you very hard this time, but you are so much in demand when we take feedbacks from our team participants or other participating team. You are one amongst the top three people are there who are always in demand. So we had to push you through that. You have to be there for our semi-finals.
Oh, thank you for so many kind praises. I'll keep contributing.
Sure. Thank you, Purvi ma'am.
Thank you.
And Annapurna madam, we have taken her for granted. Only difference is she is in Pondicherry. In few days, you will see her in Nagpur. She has become so much of an integral part of our brain teaser team. Thank you, ma'am, once more.
Thank you, sir. Thank you very much.
Thank you.
Thank you, team
Bye.
Highness, as well as Saif and Numerotech team. Thank you.
So meet you on next Wednesday, same time at 7:30 p.m. New 10 teams and new 3 quiz masters.
Bye-bye.
Thank you.
Best of luck. Good luck.